Students, we are going to study about chronic toxicity studies in this session. In previous videos, we have learned about the acute toxicity, we have learned about subacute toxicity, and now we are going to study about the chronic toxicity studies. Okay, in acute toxicity, what I have earlier explained you that acute toxicity are done with a single dose for 24-hour period or for 1 to 2 days they are done. Subacute toxicity goes from days to weeks, like it can go from 14 days to 90 days study. But chronic toxicity studies goes from weeks or goes from months to year. Okay, these studies can extend up to year, 2 year, 3 year. Okay, why these chronic toxicity studies are important? Why we are performing these chronic toxicity studies? See, acute toxicity studies are done for seeing, or they are done generally for calculating appropriate dosage of a substance. What dose is to be given to the animal or human being. Subacute toxicity studies are done to check the nature of toxicity of a substance, whether drug produces toxicity within a single dose or within a repeated dose. What are the effects with the repeated dose? And why these chronic toxicity studies are important? Why we perform these studies? These studies are performed to check whether there is change in function, shape, or any kind of reproductive change in an organ, tissue, and cells. What does this mean? See, in acute toxicity study, we cannot determine the ill effects of the drug on our organ, each organ. Okay? In subacute toxicity also we cannot perform that. But if we keep repeating doses for several months, year, what the changes occurring in function in our body? What changes are occurring in shape of the cells? What are the changes during reproduction or organ, tissue, or what are the cellular changes we are getting? On these studies are performed in chronic toxicity studies of a substance. And now we are going to study the principle of chronic toxicity test. What is principle? For testing chronically, we are taking a test substance which we are going to do, or which we are going to give to the animal. We have to select one route of administration. If we have selected oral route of administration, say for example, we have to do it or categorize the drug in several groups. Okay, and we have to continue dosing of a test substance for 12 months. Here I have explained you 1 year period, 12 months. During this period of administration, animals they are observed on the daily basis. Okay, for the signs of toxicity. Any day we are getting any sign of toxicity, any toxicological significance, we have to exclude that study and we have to check the toxicological symptoms. That is the chronic toxicity study. And after the study, or if animal dies in between, the animal is necropsified and remaining survivors are sacrificed and necropsified, because that is the point where we have gotten the chronic toxicity of a substance. What kind of signs we are going to check on the animal which is died during the test? Morbidity, mortality. Okay, how many, what is this? How many animals got died? Single animal, 2 animal, 10 animals, 15 animals. Okay, that we have to notify. After that, there are neurofunctional and neurobehavioral signs, ophthalmological examinations, hematology and clinical biochemistry, tissue structure and functions, organ weight and their content. Okay, all these studies are done Additionally, various carcinogenicity, for performing carcinogenicity study, we have to extend the period, time period. Okay, for chronic toxicity studies, these are the observations, and for further carcinogenicity studies or genotoxicity studies, mutagenicity studies, the time period is increased. That I will explain in next video. Okay, thank you.